Hello, everyone. It's Friday, August the 21st. Regretfully, we've lost 4 more West Virginians. These are our 167th, 168th, 169th, and 170th deaths in West Virginia. Our 167th death, now get this, is a 35-year-old female from Fayette County. You know, just think about that life, all the life left in that young lady that we lost. We also, our 168th death is an 85-year-old male from Mercer County. Female from Mercer County. 169th death is an 81-year-old male from Mercer County. And our 170th death is an 87-year-old female from Kanawha County. I always stop to just think, yesterday I delivered a grant down into Wyoming County at Oceana. And a grant is going to help, in moving us forward to be able to help those that have been afflicted by this terrible drug epidemic. And I was so touched by the fact that I know an awful lot of people there. My grandparents on my mom's mom and dad grew up on one side of Oceana, and my dad's mom and dad on the other side in a little town, Copperston, and my mom at Huff Mountain. But on the way down there, I stopped just for a second on the side of the road at my grandmother and grandfather's house where my dad grew up in Copperston. And I just sat there just thinking about all the years and all the greatness and everything that I was able to spend with my grandparents. And I think about every day when I look at these numbers that most of these people probably are grandparents. And for this virus killer to take these people away from us, it is extremely sad. And so please keep all these people in your thoughts and prayers. I know they'll be missed, and especially think about this little 35-year-old female that died in Fayette County. I want to talk to you just a second about grandmothers here, and one of the individuals that we lost this past week was a grandmother that died from this terrible virus, like we've talked about. But now get this, she had adopted 5 of her grandchildren following the tragic death of her own child to a drug situation. It is amazing over and over and over what greatness West Virginians have done. And so, we just celebrate all that these great people we've lost and all the wisdom and greatness that they brought West Virginia and all their families through all the years. And so I know we miss them, and it's bad. And everyone is trying just as hard as we possibly can to get this thing past us. And every day we get a little closer. But we had 84 positive tests in the last 24 hours. Our positivity rate for the day is at 1.98. That's great. Our hospitalizations have come up a little bit. Our active cases came up just a little teeny bit. But the best thing that I can report is, our cumulative positive number now is at 2.36. It just continues to drop down just a little teeny bit. But the best thing of all is our reproduction number, which is the RT number, and Dr. Marsh can better tell you about this, is at 0.89 today. That's the lowest it's been for several days, if not weeks. And that is reflected in that we're the 6th best in the nation now. So that part's working, and it's just getting better. I told you we're going to tweak, our dashboard from the standpoint of how we're showing the county maps and especially reflecting, the counties that have a lower population in them. For counties that have a less than 16,000 population, we're going to now calculate those cases on a 14-day rolling average. And for counties that have greater than 16,000, we're going to continue with the 7-day. I'm sure that there'll be questions to our medical experts and everything about this, but you can come to them in just 1 second in regard to that. Our school reentry protocol update at my direction with the approval of the medical experts, the Department of Ed has modified the school reentry program or protocol. The new protocol requires face coverings for students in grades 3 and above in various settings. And the face covering requirement is for green, yellow, and orange counties, because naturally if we're red, we're closed down and we're 100% virtual. And Superintendent Birch is going to be talking about that in just a few minutes. We had our first case, and I was notified, I guess either late on Wednesday or on Thursday of our first case with this MIS-C, which is a multi-system inflammatory syndrome in children. And, West Virginia, thank God, had not had any cases, until this one. And, Dr. Marsh and Dr. Amjad are a whole lot more versed to be able to talk about this. But basically, from what I understand, it comes from either having the virus or being exposed to someone with the virus. And so they'll talk about that in just a little while, but we surely hope and pray and ask for your prayers for all those that, that are associated with this illness. But our long-term facilities today, we have 30 outbreaks in long-term facilities. We just had we've got a whole bunch of news, that we'll talk about, and I'll let our medical experts and Secretary Crouch talk more about this in Monroe County. But in addition to this, we have outbreaks at the Grant Rehab and Care Center in Grant County, the Cedar Ridge Center in Kanawha County, Trinity Healthcare in Logan County, Princeton Healthcare Center in Mercer County, Pine Lodge Nursing Home in Raleigh County, and Rosewood Nursing Home in Taylor County, in addition to what's going on in Monroe County. We have 3 active outbreaks with our churches in 3 counties now. That's Cabell, Taylor, and Wood. We have a total of 44 total cases combined. I can't go through it enough to urge you, especially the elderly, if you can skip a couple weeks of church, that may be good. If you can get it online, whatever. But if you choose to go, whatever you do, a pew in between you, wear your mask, social distance, wash your hands, do all the stuff that you got to do to protect yourself and protect others. Now, a couple good things from the small business grant program and everything. That's moving and moving. We now have in excess of 2,500 applicants in. We've awarded $10.4 million. We want this number to keep growing and growing fast, from the standpoint, and I'll get to it in just a second, but, the sole proprietors that don't really have employees and everything, that are receiving the $2,000, that application stuff is up. They ought to, and get after it, apply as fast as you can. And we'll get that money out the door to you just as fast as we possibly can. From the standpoint of the cities and the counties, we have now sent out $86,500,000 to 178 cities and counties. That number continues to grow up just a little bit. We want to tell people, keep applying, keep doing what you're doing and everything. Every dollar that we can, within the guidelines, get out to our cities and counties or to our people, small businesses, is just dollars that are going into the hands of West Virginians, and the multiplier effect on those dollars is real. And so we want to just keep it going. Free testing wise, today we're in Hancock County. Tomorrow we're in Hancock and Monroe counties. Next week we'll be in Boone, Lincoln, Mason, and Webster County. Take advantage of the free testing. The more we test, the more we know, the better we'll be, the better we can help you. So just please stay after it if you can. Now, one of the fellows that here just wrote something on the board, and that's why I smiled during everything. I can't possibly understand what it is, but I looked at it and everything. But nevertheless, okay, from our summer feeding program, we have 696 sites, and we've fed we've absolutely been contacted well in excess of 10,000 people. No one in West Virginia needs to go hungry. Please call us on 211 if you're having a problem. Let me talk to you about the census just a second. Every day I preach to you how important it is to get counted. Now just think about this, West Virginia. You make me so proud. I mean, that's all there is to it. You just absolutely light me up every day, and you would never believe how much it means to me to see you in action, West Virginia, because I'm going to tell you, this job is tough. It's dog tough to come out here and talk to you about people we've lost and the tough things and make decisions that we know don't have an absolute right answer. They have the best answer we can possibly come up with. It's tough and it's lonely as it can be. But this is what keeps me going right here. I have asked you, West Virginians, to help me, to be counted. I've asked you over and over and over, help me. It's really important. Be team captains, be community captains, be street captains. Call your neighbors. Let's get counted, West Virginia. Come on, come on. And I felt like we were behind. I keep telling you this and everything else. Now get this. And this is what I'm telling you. This is where you really make me smile. In 2010, our total response in 2010, in the census in 2010, the total response for West Virginia, the total response was 74% of our people got counted. Okay, today in West Virginia, right now, and we still have until September the 30th. So we've still got a good bit of time to get the rest of us counted. But today in West Virginia, we're at 84.5%. We're the second highest in the nation. So West Virginia, you absolutely make me smile. You make me happy. I'm really proud of what you've done. Let's get it well over 90%. And thank you so much to all those team captains that stepped up. And I know that were helping me all out in the wilderness and everything, because you have done a great job, and it will, for 10 years, it will be an impactful, positive event for West Virginia. So thanks a bunch. Let's get it above 90%. Let's absolutely be all counted. Let's be number one in the nation in the census and everything. So we got a few more days, but I couldn't be any more prouder of you. Our EMS grants, we're going to authorize 10,000 that are going to flow out to our volunteer EMS agencies across West Virginia, and I think all that's going to happen, from what I know, immediately, and if immediate means the first few days of next week and everything. So we're on that, and I know that it is a small token of thanks for all that you're doing. But we want to absolutely do any and everything we can to help, your organization and what you're doing, because our volunteer EMS people are unbelievable, and we know how you run to the fire, and we're just trying to help a little bit, just like we did with the volunteer fire departments. On plasma donation, we have received some calls regarding plasma donation in West Virginia. There are some innovative uses for plasma in treating the COVID-19. We have been working on standing up a plasma donation operation in West Virginia for a while, and Dr. Marsh and General Hoyer will be talking to you more about that. My last thing is just this. I don't know how many right here with me remember this great man, but General Tackett did an incredible amount of work and service for our state and this nation. As well did Sally Pat, his wife. And we just lost Sally Pat today. So please keep them in your prayers, your thoughts, and just in your memories, because this was a great man and woman that have done great work for us. And so, you know, General Tackett, know that lots and lots of West Virginians are praying with you and are praying for Sally Pat. But nevertheless, I'll end up by just saying this. You know, if you'll look real quick at our charts here and everything, and you'll see that our recovered cases keep moving on up. Our active cases, you know, kind of flattened out just a little bit. We're getting wider there. That's really good. You notice in our daily, in the middle graph, our daily positive is bouncing around that dotted line where we went many days way above that dotted line. We didn't like that. And we're starting to slide back down just a little bit, which we really like on our cumulative positive stuff. We have now tested 384,000 West Virginians. Let's keep doing it, West Virginia, and keep up the good work. You made me really happy in lots of different ways. You know, I hate like crazy to talk to you about losing West Virginians like I did in the beginning, but you know, I'm really proud of you from the standpoint of all the different things that we're doing, whether it be school reopenings or it be, you know, our daily positive test or it be the census. You know, just you do a lot of good work, West Virginia. You deserve lots and lots of credit. And the very last words of this: if you could just all, West Virginians, be in the room with me when somebody trots in from the federal government, like Dr. Birx did the other day, and when she sits down and she starts really, she already knows the numbers, but when she starts really talking to our medical experts, to our education heroes, to all the people from our National Guard and all the great work that they've done, when you see her look on her face, she can't believe it. She looks at these numbers and she's intrigued. Well, how in the world are the numbers that good? But when she looks in the face of our people and sees their intelligence, sees their commitment and their passion and everything to what they're doing, she then becomes a whole believer in West Virginia. So I wish so much that I could pass that on to you, you know, but believe me, that lady was really impressed with West Virginia, and she's doing a great job with our federal government. She's you know, a hero in every way, a colonel in the Army. She's an absolute remarkable lady, and we're really blessed to have her. So that's about all I've got for today, but thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. It's great to be here in Charleston with the governor today. There's several things that I want to follow up on that he mentioned. So number one is our reproduction score, which is that RT value that you can follow as well on rt.live, has moved from the worst in the country a few weeks ago. And as the governor said, today we are the sixth best in the country at 0.89. And that is really quite an extraordinary success predictor. And as we look at the cause of this, and we will have some graphics next week from General Hoyer and National Guard, but right about the time that the governor issued the executive order for mask wearing, we saw our RT values start to come down. And we know that's really, really important because that is a predictor, a precursor from predicting that there's going to be a reduction in cases and hospitalizations over the next 2 to 3 weeks. Now that happens simultaneously, which is really good that we've been able to do this great work. You have been able to do this great work, people in West Virginia wearing your mask, staying distance, because we're about to embark upon perhaps the trickiest part of our response to the COVID pandemic, which is the opening of universities and opening of K through 12 schools. And as the governor said with Dr. Birx, she was really excited about our color coding map and system to do really two things. Number one is to make sure that the places where the schools open are safe. And we know, as we said before, that the best predictor of the spread in schools is the spread in communities. So the more we can control community spread, the more we can control school spread. And the second issue is the ability to continue to be very diligent in school with our children and our teachers and our staff, doing the same sorts of things by wearing masks and staying physically distanced and doing the things that we know reduces that person-to-person spread. One of the issues with the color-coded map that we have produced, the governor asked us, what happens when you have smaller counties? Is that fair to them? Because again, we are correcting all of the population of the counties to 100,000 population. So really small counties with populations of 5,000 or 7,000, they're really having to be multiplied the cases by a big number, which may in fact bias against them. It may make them look worse than they are. And when we go back and talk to our public health experts and our mathematical experts, what they say is we really should try to get a total of 20 cases during whatever period of time that we're using. So using statistical methods, we found out that the median West Virginia County, the one in the real middle, is 23,000 population. And when we look at outliers, two standard deviations that separated from that, we found 16,000 being that number. So instead of doing 7-day averages, which we'll do for all of the bigger counties, because that gives us that requisite 20 cases and allows us to make decisions faster, as the governor said, he challenged us, and what we suggested to him is we expand that time interval. So instead of 7 days, we'll do 14 days, and that will allow us to get up to that 20 case level to make decisions, which will be much fairer for our smaller counties. Now, the other thing the governor mentioned, which is really important, is we have our first case of the multi-system inflammatory syndrome in children, MIS-C, children. And this is a disease that is recently described related to COVID in children 21 years old or less who have fever, who have evidence of COVID infection, on average about 25 days after the infection happens. So many people don't have active COVID infection, but they had it, and they have evidence of inflammation. And this is a syndrome that really is where your body's response to the virus may be the real problem, and 2 or more organ systems have to be involved: the heart, the kidneys, the lungs, the liver, the blood pressure. And these are people oftentimes who develop inflammation of the great blood vessels, like a syndrome in children called Kawasaki's disease, but it's a much more severe form of that. And we have a child in West Virginia now who has met those criteria, and there is very prescriptive treatment, which is treatment designed to reduce the immune system's response against the activation that's happened for the virus. And so that child is now being treated very aggressively and expertly in West Virginia. But that is important to note because around the country, I think there's about 600 cases, and this is the first case that we've had in West Virginia. And lastly, the governor brought up the use of convalescent plasma, taking blood products from people that have been infected with COVID-19, who've developed an immune capability against the virus, and isolating the plasma, a part of their blood, and then being able to give that to other people where the blood types match. It's been shown in research studies that reduces the severity of illness in people that need to be put on a mechanical ventilator in the ICU. That's still an experimental protocol, clinical trial, which we're part of here in West Virginia. And we have, through the National Guard and the governor's office, we have been able to secure freezers to be able to have stores of this convalescent plasma here in West Virginia to be able to be used just like remdesivir, the drug that is the antiviral drug, can be used in combination in people who are really sick. And General Hoyer will expand on that. But I also am really proud of the incredible work that everybody in the state is doing. And I would just tell you, whether you're young or not, you're not immune from the side effects of COVID-19 as we're seeing with this child in West Virginia. And we know that the greatest increase in the number of cases in the state and across the country are in that young group of people, that 19 to 38-year-old group of people, and even younger in some situations. So West Virginia, continue to do the great work you've done, and we are a place that everybody is starting to recognize because of your great work. So thank you.
Great, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. Let me talk a minute about a few of our long-term care outbreaks, our nursing home outbreaks. First of all, I want to talk about Monroe County that has popped up in the last 2 days, actually yesterday when those numbers came in. When Dr. Burks was here, she asked why we were successful, how we were kind of staying ahead of other states in terms of what we do and how we do it. And our response to that, we had a couple of responses. Our leadership and the direction we get is important as it is in all organizations. So we have the right direction here in terms of what to do, but the cooperation that we have with the local health providers, local health departments, the nursing homes, the Nursing Home Association, the Hospital Association, and others is one of the reasons we think we are successful. The Monroe County outbreak is a good example of that. We just learned of that yesterday. I will say Stonerise acted immediately to test all patients in the facility, all staff in the facility. In addition, began testing other facilities that they own in Greenbrier County and other places. So they acted very quickly. We immediately began to look with regard to our resources, how we could help in terms of speeding up testing, which we did. In terms of getting Guard resources to them. National Guard, again, is just outstanding in terms of their assistance. But I also want to thank the local health officer of Greenbrier County, who, as we speak, is on her way there to provide assistance to the facility in Monroe County. Earlier today, she actually sent 2 nurses and the Guard, National Guard individual who's there assisting her, asked them to go to the Springfield facility in Monroe County to provide assistance. So there's also a meeting scheduled call this afternoon with CMC and the ownership. Larry Pack has arranged that to try to make sure that there's plenty of oversight with regard to any patients that need transferred, et cetera, and any assistance that CMC might provide. So again, what we see in West Virginia is consistently an all hands on deck approach when we have an outbreak and assistance from everyone that can provide assistance at any level. So I thank all of those folks and all of you for what you do out there. Let me talk a minute about the county alert system. Clay mentioned that, the governor mentioned that. You will notice on the dashboard today, just came up actually at 12:30, the latest map, which is now titled the County Alert Map. The reason for that is that this map will be used for different purposes now, rather than just the school alert system. We had been working previously on an alert system for nursing homes that would allow them a way to gauge community spread in their counties and their communities, to guide them with regard to visitation. As you'll recall, the governor asked facilities to stop visitation last week until we could look at this situation a little better. The number of outbreaks we have in the state has grown. We have an outbreak now in Kanawha County at a facility here that has 23 residents and 7 staff who are positive. We have outbreaks in Grant County, Logan County, Mercer County, Raleigh County, Taylor County. So as I've talked a couple of times, we started out with this disease in long-term care. And then we leveled off with regard to those the number of outbreaks. Those are picking up again, so we're renewing our efforts to try to make sure we do everything we can. So the visitation was an important decision by the governor to make sure that we had good guidelines going forward for all nursing facilities. So this map will also guide them, and the way that will work for nursing homes, excuse me, is they will also use the color-coded system. Phase red is the highest level for to define reopening activities, and phase red will restrict visitation, except in compassionate care situations, and also restricts activities such as communal dining and non-essential services. Phase orange continues to permit compassionate visitation only, but permits some facility activities, including communal dining and non-essential services. So they're using this same color coding system in different ways to make sure the community understands where they are with regard to risk. Yellow will permit visitation and continues to permit facility activities, communal dining and non-essential services. And of course, green is even with fewer restrictions. So we believe this alert system worked very hard, and I want to thank the Nursing Home Association and the nursing home providers who worked with us to make sure this was a system that met their needs and worked well for them. And I also don't want to forget to thank Clayton Birch and the Department of Education for work with them and for being such a good partner in developing that system for the school. Let me mention one other thing with regard to those issues. The map, a map, will be posted by the Department of Education for sporting events. That map will be effective for the entire week. My understanding is, and Clayton may talk about this more, my understanding is they will post that map Saturday evening. That map then will stay up, as we've talked about before. Counties that are in orange will cease any sporting activities, organized sporting activities, and extracurricular activities, but will be allowed to continue practicing. So that will be the map that will be posted on the Department of Education website that schools will follow for that. If a county should turn red, then that will change that situation somewhat with regard to not closing schools, but having education that is virtual or not face-to-face. So Clayton can talk more about that as well. With regard to the nursing homes, let me mention their activities regarding visitation will also be for the week. So they are planning to post a map that will be for the week as well with regard to visitation and where facilities are within that county. So I hope that's clear. I'd be happy to answer questions later on that. Thank you.
All right, thank you both. Next, we'll go to Clayton Birch, our State Superintendent of Schools.
Well, good day. And first and foremost, we have a lot of updates today for education. As you heard Secretary Crouch allude to, the partnership over the last several months, but especially the last couple of weeks, has been pretty intense. Dr. Amjad, Secretary Crouch, General Hoyer, Dr. Marsh, they have been gracious with their time. I know it's been some late nights the last couple of weeks, but we'll kind of start with the metrics. And as Secretary Crouch alluded to, every Saturday we will post that on our website. That'll be the Keller you follow for the entire week. And our website will also include any announcements from the schools. So it'll be one place you can go to, know everything you need to know, but there's going to be one addition that the Keller coding system will include now, and it's what we heard the governor say earlier, and that is we now, at the governor's request and working with health experts, have made a recommendation and finalized mask or face covering requirements, and it is going to be actually released today. So green will be required face coverings for grades 3 and above when they're on the buses, they're in congregate areas, anytime they cannot be in their core groups. As you shift up to yellow for grades 3 through 5, it will stay the same. trying to keep them in their core groups as much as possible, wearing masks on the bus, outside of their core groups in congregate areas. Grades 6 through 12 will be at all times. And then, of course, we know orange is when we start to creep into additional mitigation, working with the community, and it would be universal mask wearing for grades 3 through 12 at all times. So we will post that today. I know it's on the screen now, and that will be part of our weekly update. So when we post the map each Saturday, this will go along with it, along with any specific updates from each and every county we will include. As the county plans have come in, we've reached out. One of the things that we told all the county superintendents when their plans came in, there is no excuse for anybody not to be ready on September 8th. That means all supplies, as much disinfectant, cleaning, face coverings, anything necessary, we wanted to make sure they were ready for September 8th. So we have done a survey. They have sent us in any items down to even gloves for their custodians. If there's any item they're having trouble getting, I want to thank DHHR and General Hoyer. They have stepped up. They're going to help us fill that gap prior to September 8th, and that way there are no excuses. We all are going to be very, very prepared for September 8th. That, combined with a safe metric, will assist greatly. And finally, I want to thank General Hoyer, and I kind of feel like I'm taking a little bit of thunder away from the governor on this one, but we have some good news on the Kids Connect. The Kids Connect project for 1,000 points of Wi-Fi across the state. The installation is going great. It looks like we are absolutely on schedule, if not ahead of schedule, and we are now adding additional sites. General Hoyer contacted us. He would like all 20 armories in the state to join, and I am proud to announce they will be added to our map. We are putting them in line to be installed, and we are thrilled to death to add 20 additional sites. If anybody out there has questions about reentry, Kids Connect, your color for your metric, anything related to school reentry, we launched a hotline. We have a full-time person dedicated to this hotline. Bless them. It is 304-957-1234, and that is for any question. They will get you to the right person or the right resource to help you with any question at all when it comes to school reentry.
All right, thank you, Superintendent Birch. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. We'll start with an update on PPE. Our strategic stock of PPE is green across the board, across our areas, but we are starting to see an uptick in use of PPE in long-term care facilities, as outlined with the number of outbreaks that the governor and Secretary Crouch mentioned. We are working with the association as well as with the individual facilities to make sure that we help them stay on top of PPE rates. We'll let you know that the folks from Greenbrier County that are supporting Monroe County Nursing Home Initiative are going to be using the PAPR systems, which are the reusable systems that we got approval from the governor to purchase early on, so helping with that burn rate. Testing continue to be a significant amount of testing. DHHR, the National Guard, and others continue to work with local partners. I think it's important to point out that if you look at the total number of tests as a percentage of the population of our state, we actually are testing at a higher rate than the national average right now. So significant effort by a lot of different partners on testing, and even when you factor in the number of additional tests that an individual takes from a recovery standpoint, we are testing at one of the highest clips in the nation right now. Sanitization missions continue to be a large number of those going on. We have 42 machines that we now use for sanitization missions, and all of those today are actually in operation. As was mentioned, plasma, there has been some discussion about plasma, and Dr. Marsh pointed out the efforts on the freezers. Also want to let folks know that we have been working since the beginning of this pandemic with the Red Cross here in West Virginia. We're looking at a couple of additional initiatives. One would be to actually be able to take blood and then have the Guard assist with transport for the Red Cross to these centers. And the two closest to us in West Virginia right now are in Blacksburg and Pittsburgh. So we understand that there is an issue. That was an issue I raised on behalf of the governor with Dr. Birx in the event that we would like some assistance from the coronavirus task force for equipment as well. So we continue to work that. Also want to make sure to point out that there is a contact tracing scam going around nationally right now. Jordan just put up on the screen, we'll have on the governor's website, National Guard. We'll make sure that DHHR and others get this up, but want to make sure particularly our elderly citizens are not targeted by a scam that calls and ask you or let you know that you may have come in contact with someone who has COVID-19, and they start out by asking you for personal information, potentially social security number, and in some cases have even attempted to get credit card numbers for certain items. So please pay attention to that. If you're being contacted by somebody with DHHR, local health departments, or National Guard, they will not be asking for credit card information or other sensitive information. And then the last thing, as the governor pointed out, the National Guard family lost a great member in Sally Pat Tackett. She was a tireless advocate for families and children in the National Guard. So on behalf of Amy and I and all the members of the National Guard and our families, we send our love and prayers out to General Tackett and his family. Thank you.
Thank you, General. We'll now go to questions from members of the media. Our first question today is from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, in the weeks prior, you have identified Myrtle Beach as a really big problem for the virus coming into West Virginia, and you seemed on the brink of announcing something earlier this week, and you didn't. You said that some of the metrics had improved. Could you identify those metrics, and could you maybe go into what you could do to limit people going to Myrtle Beach and coming back with the virus?
Well, let me try to address the tail end of the question. And this, you know, all of this information has got to flow to me through the medical team and medical experts. And basically, you know, as far as the metrics, I'm going to let them discuss, you know, the improvement that we've been seeing and how we're trying to address it. We have had a lot of trouble out of Myrtle Beach. Now, we all know and love Myrtle Beach, you know, and I can't probably think of hardly any West Virginian that's not visited Myrtle Beach on some level of vacation, because it's close to us, they got lots to do and everything, and it's a fun place to be. But in doing so, we also know of all the troubles they had and all the troubles that we brought back here. Now, in doing that, the discussions that we had were along this lines, that if you had traveled to Myrtle Beach, or you were going to travel to Myrtle Beach and everything, we were going to look at making it mandatory that upon your return, that you had to go 5 days of self-quarantine, and then after the 5 days of self-quarantine, you had to be tested and come back a negative test before we could go forward. Now, that was the discussions that we had and everything. From the metric of measuring it and how we're going to do it, you know, that was, you know, that part started to soften a little bit and got a little bit better. And so, and we've always got to look at just the fact that people go a lot of different places too, you know, and to be able to handle where everybody's going, you know, that was a real challenge. But at the same time, Myrtle Beach, we recognized Myrtle Beach was a real problem, and we had a lot of discussion about it and everything. But if I could pass to the medical team, and Dr. Marsh, you know, you could maybe answer a little better than I could.
Sure. Well, thank you for the question. As the governor said, we've been following Logan County particularly very closely. As we look at the map, we see that Logan is our red county. As we are looking at the mitigation efforts that have been done through the nursing homes, through the hospitals and the other outbreak areas, that we see that RT value has the bottom part of that, the lower limits has gone under 1, and our incidence rate is slowly reducing. And so we are keeping the governor on a daily basis apprised of what we're seeing all over the state, but particularly in the areas of the state where we have the red or the orange color. This is another example, though, if you look at the Harvard Global Health Institute data, and you look at the data that we are generating, that's the one issue about the community spread, which we're really looking at, versus the community plus the spread. And since we have outbreaks that involve nursing home and even a hospital area, then by separating those two out, we actually get different insights about some of the outbreaks that happen both in West Virginia and in the greater country.
All right, thank you, Paul. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi all, it's Taylor with the Herald-Dispatch. Hospitalizations and people on ventilators and in the ICU are really high today. And I was wondering if anyone could talk about the Surge Hospital and if there had been more patients admitted there, if there was talk of maybe activating more beds because of the situation, or if it was all still under control. Thanks.
That's you, sir.
Okay. Well, we know, Taylor, that we have seen some variability in hospitalizations, and today people that are admitted to the hospital, whether they are adult or children, pediatric patients, their risk of going to the ICU is about the same as about a third of the people admitted to the hospital go to the ICU. As we look at the number of COVID-proven people or people suspected under investigation for COVID, we know that although we can see elevation, that we still have substantial capacity related to COVID. But as we've said before, the hospitals are actually very busy these days, catching up on a lot of the work that was reduced during the time that we opened up for surge. And also, as we have increased the elective procedures in the hospitals, so our hospitals are full, but not of COVID people. And as we go forward, we are watching that closely with the Hospital Association as well, in case we would need to reduce those numbers of elective procedures, which will reduce the volumes in the hospitals, which will open up more room. We're watching that closely every day, and at this point, we don't have concerns that COVID is overwhelming the ability for us in West Virginia to take care of people who can get severely ill.
All right, thank you, Taylor. Next, we'll go to Annie Moore with WVVA.
Good afternoon. In July, President Trump announced the procurement and distribution on a large scale of the rapid tests to the nursing homes. Are we seeing any of these for the nursing homes in West Virginia to test staff as they're coming in and out?
It's you again, sir. You're hot today.
Well, I'm happy to start. I'm happy to start and then invite anybody else to comment. The tests that the White House Coronavirus Task Force are getting for the nursing homes are the antigen tests, which are basically testing proteins that are on the surface of COVID-19. And these tests are also used in not exactly the same tests, but also used for other viruses like the flu, like other viruses that we see in the wintertime. And there's the thought that we're going to put all those viruses together so you could test for all of those, maybe with a single swab in the future. So that's a technology that we're all very excited about because it's very rapid and it tests directly the sort of the proteins, not the genetic material from the virus, but the proteins on the virus. The problem with this test is it's not nearly as good at picking up COVID as the PCR test is. But if the test is positive, then it's really pretty darn good, close to the PCR test. So we plan to use that not only in the nursing homes, but probably across some other sectors over time. And we know that this test will continue to evolve and get better. But as it goes now, we do believe this will be helpful for nursing homes. And I think your point about potentially testing some of the staff in and out is important. With the staff particularly, though, we want to be very, very sensitive at picking up all the people that could have COVID. So I don't know if the test is quite ready for the level of sensitivity, meaning picking up everybody who has the disease, as opposed to specificity, identifying people who are positive as people that have the disease. So I think the staff question's a good one, but maybe not quite there yet. But the disposal for outbreaks in nursing homes is something that I think can be very usefully helped by this.
This Bill Crouch, Clay, let me just add one thing with regard to the question. We did learn yesterday that we have 2 nursing homes in West Virginia that have received those tests, and that other nursing homes are being readied for those tests. So that is coming to West Virginia. To West Virginia nursing homes in the next several weeks here. Just to answer the question, yes, it is something that is coming to West Virginia nursing homes.
All right, thank you, Annie. Next, we'll go to David Beard with the Dominion Post.
Hi, I have a 2-part school-related question. The first part deals with liability protection is being debated in Congress, and what kind of liability protections currently exist in West Virginia for at the K-12 and higher ed level for if kids or others get sick or die. And part 2 came to me from some parents who were hearing that if their kids take school all online this year, they'll have to repeat the grade next year, and they just like some reassurance that that's not correct. Thanks.
Well, I'm going to defer to Superintendent Burch, but I can promise you the latter part of the question is not correct. But go ahead.
That's a pretty good answer. It's absolutely not correct. We have right around 55 to 60,000 children enrolled in virtual school this year so far. We said earlier this week that makes up about almost 20% of the students that want to partake. And that is an absolute legitimate route to virtual school. You will not repeat the grade level the next year. It is the same content standards that your peers will be doing in person. So absolutely not. That is false. As to the liability question, that is something that both Chancellor Tucker and myself have heard about, and I think maybe at a future time we can talk about that.
All right, thank you, David. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. What are we learning as we see other school districts, universities, football teams in different parts of the country experiencing what they're experiencing as far as outbreaks and surges and problems? So what are we learning from those guys while we still have a week or so or 2 weeks and change before public schools go back in, and a little bit less than that before high school football kicks off? And of course, our university is already dealing with their own problems here, but is there anything to be learned from what we're seeing across the country? And do we have enough time to implement lessons from what we've learned to try to make it a better experience here?
Let me try to do this, okay? I think I can handle this best, Kenny. Kenny, I think if you could be on the inner circle and see all the information that these great people as experts are looking at and adjusting and digesting as they go. Now, if you'll think about just your question, we have learned in many instances how we can move ahead, full steam ahead. And on other instances where people are having a negative impact and a negative outbreak, we're learning from them on how we need to hold the reins just a little bit and adjust and do just the exact same pivoting that we've done over and over and over. Now, from all of that, we compile all the information from both the negative and positive sides, and we combine that information with our on-the-ground know-how here, with our SSAC, with our Department of Ed, with our medical experts, with our team of what we know is going on here. So in other words, we combine the good and the bad from the outside, and we bring it together with what we know is going on here, and then we try to make the very best decision that we can possibly make and still be able to move forward and still be able to live with the risk, but not put our kids and put our people at risk if we feel like that it's unsafe to do so. So, you know, it's kind of a generic answer, but if you could see the input and really the work that goes behind the scenes, you'd say, well, it's not a generic answer. It's real, and that's what we do.
All right, thank you, Kenny. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. My question is, you know, with the upcoming election and so many concerns over the post office, I know Senator Manchin was here the other day, and that there's been some sorting machines that have been removed from a distribution center. My question for you is there anything you can do in your office as governor to ensure that this election runs smoothly, given the fact that so many voters are going to be relying on the mail to be voting this time around?
You know, first of all, I don't think so. I think this is the Secretary of the State and the Post Office to be able to handle this, and I think that's out of my arena. But whether I think that or not think that, you know, to be perfectly honest, I have not been focused on that at all. You know, I am focused on trying to make the best decisions that I can make to protect our people and help our people, you know, from the standpoint of going back to school or not going back to school or sports or all the different things that go into looking out after, you know, the testing and evaluating the numbers and all that. And so from that standpoint, I don't think that I can do anything, you know, and I think that's for another office, Secretary of State or the Post Office to be able to do so. But to be perfectly honest, I've not done any work in that area.
All right, thank you, Dave. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor or anybody else on the panel, do we anticipate any more significant changes to the school metrics and the school protocols between now or the 8th? Is this set in stone now with this final tweak with masks and the recalibration for the small counties?
You want to go?
Absolutely. So these small tweaks are actually really important tweaks. I appreciate that our health officials and the governor has never stopped discussing these tweaks. These are all important as we lead up to September 8th. It kind of ties into the answer of lessons learned and things that we're preparing for. We will continue to listen to the field, adjust as we need to, but you know, we're 2 weeks out from Tuesday of our children coming back. And we'll continue to listen to the field and meet their needs.
All right, thank you, Charles. Next, we'll go to Haley Kosick with Nexstar Media.
Hey, everybody. Happy to be here. My question is for the governor regarding the 2020 census. I believe you said that over 80% of West Virginians have responded so far. And with such a high turnout, it has been said or mentioned a few times to me specifically that losing a congressional seat regardless is a possible threat. Is this true? Can you comment on it? What are we looking like after the 2020 census?
To be absolutely certain, I don't have information on that. I can get you information on that, but I can't answer that right now. I don't know. I know one thing. I know that how dollars flow to our state, the more we're counted, the better off we'll be. And like I said, I'm tickled to death with what West Virginia is doing. You know, they're second highest in the nation, only second to Idaho. And so we can't get beat by a bunch of taters. I mean, you know, for crying out loud, you know, we got to push that over the top. But I can't tell you as far as congressional seats. I don't know the answer to that.
All right, thank you, Haley. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Taylor touched on this earlier, but it looks like there are higher than ever numbers on the DHHR dashboard for West Virginia hospitalizations, 146 showing today. Also, a high number of people in the ICU, 54, and people on ventilators, 24, which is among the highest ever. And so I wonder what explains that phenomenon when other aspects of West Virginia's numbers seem to be stable. Thank you.
I'll pass to Dr. Marsh or Dr. Amjad on that, and they can answer. But I would just say this, Brad, in the scope of where we are in West Virginia, looking at numbers like cumulative positives of 2.36 or daily positives 1.98, and looking at that, you know, as we move up in hospitalizations, they look like, well, they're alarming, but their capacity of hospitalizations is much greater. So we're in great shape in regard to that. But I'll let Dr. Marsh answer that.
Well, thanks, Brad. I think that let me just make sure that we're communicating this clearly as well, because we know around the country the number of coronavirus cases is starting to go down, but the mortality rate, the death rate, has not gone down as much yet. And I think as we look at West Virginia, as we look at the United States, what we find is that COVID-19 has moved from urban centers to rural centers. And as we look at people in the parts of our state that have had the highest risk of bad health outcomes, comorbidities, obesity, smoking, diabetes, high blood pressure, heart disease, cancer, this is the part of our state now that's being more affected by COVID-19. So I think that your observation at the DHHR website that we're seeing people that are becoming more severely ill with COVID-19 is really a reflection in many ways of the part of our population that is being infected. Remember, Kaiser Family Foundation rated us as the most vulnerable state in the country to begin with. And also some of these outbreaks that we're seeing in nursing homes and places, congregate places, where we have people that are very highly vulnerable to suffering much more severe outcomes if infected with COVID-19. So I think that that's what you're seeing, the reflection. But as the governor said, we have a lot of capacity, that these numbers are upticked from before, but as opposed to the capacity we have in the state, they do not threaten our state's capacity on inpatient hospital beds, ICU beds, or ventilators.
All right, thank you, Brad. We have one more question today. It's from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Regarding the new policy for compulsory mask wearing in public schools when counties are yellow or orange, what's intended as a enforcement mechanism to assure that these mandates are followed?
That's you, sir.
Sure. So, Phil, thank you. You know, we'll rely on our teachers and our administrators to enforce that. It's necessary. We've worked with our health officials. It is absolutely their recommendation that this controls the spread. We've got to keep our communities safe in order for our schools to stay open. So the enforcement will be absolutely reliant on teachers and principals to assist us with that.
All right, thank you, Phil. Governor, I'll turn it back to you.
Okay, I'd add one other thing, Phil. You know, each of our counties, you know, they develop plans and they are responsible for their plans, and we're trying to push as much local as we possibly can. We've got to do some from the state standpoint and everything, but all the people that are working this, you know, from our Department of Ed right on down to our local counties and superintendents, they're doing great work. They're, and I think they've, for the best that they possibly can, they got this right now, and we're just going to keep moving forward with that. I'd like to say one other thing. For any and all that are out there that want to vote by absentee ballot and everything, all that's available to you, and I'd encourage you to that if you're planning to vote by absentee ballot because of whatever the situation may be with COVID or whatever traveling or whatever you may have, just follow the guidelines from our Secretary of State, and because we want everybody to vote and everybody to have an opportunity to vote. We want to absolutely remind everybody that the safest and best way to be counted is from the standpoint of pure counting, is to come out and vote in person and everything, because we all know that there is some possibilities of things from absentee balloting and so on like that have happened in the past, and we don't want that to happen if we can prevent it. But I think we've closed up those loopholes as best we possibly can, and so again, we want everybody to have the opportunity to vote. Now, the last thing I'd say is just this, and I want everybody to listen to me, because I want to take my hat off to every single one of us in this state, all of our medical experts, the National Guard, the DHHR, local health, all of our first responders, fire, police, my gracious sakes of living, everybody that's out there doing all the great work, the EMS groups, volunteer fire, everybody. And if I forget somebody, please forgive me, because I mean to include everybody. But what if I were to have said to you, there'll be a time when there'll be a pandemic, and there'll be a time when in that pandemic that West Virginia will be exposed to the highest degree of any state in the nation, the oldest, the sickest, the absolute most vulnerable of all states, with states all the way around us and no ocean around us and everything. What if I were to have said to you, there'll be that time, and in that time, West Virginia, you will become the model. You will become the one that is the absolute best. And you will become that because you will all be together. What would you have said to me? Really and truly, West Virginia? West Virginia would do that? The state that forever competed with Mississippi on who was going to be dead last. But West Virginia, you're doing it. And you just keep on doing it, because you have become the envy of the nation in lots and lots of ways. Continue to pray for those that we've lost, but continue to keep pitching this incredible game that you're pitching. You've done great, great work, and everybody, from the Department of Ed to my office to DHHR, the National Guard, all of our health community, for crying out loud, and on and on and on. Way to go. And especially you, West Virginians, way to go. And just keep it up. Keep it up. Thanks for getting counted in the census too. Just keep it on. We got to get past those taters. We got to get all the way in the 90s. So y'all do it.